be required to pay for those services. Instead, insurance companies must offer the care free of charge.
I've been confident from the start that we could work out a sensible approach here, just as I promised. I understand some folks in Washington may want to treat this as another political wedge issue, but it shouldn't be. I certainly never saw it that way. This is an issue where people of goodwill on both sides of the debate have been sorting through some very complicated questions to find a solution that works for everyone. With today's announcement, we've done that. Religious liberty will be protected, and a law that requires free preventive care will not discriminate against women.
Now, some religious leaders continue to believe that the mandate was good public policy, regardless of whether it violated the teachings of the Catholic Church. And joining us now from Boston is the Reverend Catherine Ragsdale, who is the president and dean of the Episcopal Divinity School in Cambridge, Massachusetts, and she joins us now. Reverend Ragsdale, tell us about your reaction when you first heard what President Obama said today.
Well, actually, I was quite pleased and impressed. He has still, and relieved, frankly, he has still a plan to ensure that every American woman has access to contraceptive health care if and when she needs it. And he's managed to do it in a way that has won the applause of both the Catholic Health Association and Planned Parenthood. So what could be bad? I'm, again, very pleased and very impressed that he's managed this compromise.
Now, the Catholic Bishops Conference, U.S. Conference on Catholic Bishops, said basically they're going to look at the details and that there's perhaps more hope than there was yesterday, but they've clearly not given this their imprimatur of approval. And I guess my question to you would be, Reverend Ragsdale, what about the religious conscience of those employers who might not be affiliated with a religious institution like a Catholic hospital, but who nevertheless themselves have their own moral qualms and reservations about paying for insurance that provides this coverage? Why does their religious liberty not come into play?
Well, I think the issue is the religious liberty of the people who need this health care. It's perfectly fine for the Roman Catholic Church and others who agree with them that contraception is wrong. It's perfectly fine for them to believe that. That ought to be supported. They have every right to teach that. They have every right to bring to bear their considerable moral suasion to persuade people to follow their teaching. What they don't have the right to do is to cross the line from persuasion to coercion by denying people the option to make their own choices of conscience.
You said coercion. Well, hold on. You said the word coercion, which is a pretty loaded word. To say that the Catholic institution would coerce women, I guess, not to get these services or prevent them from getting these services is a complete mischaracterization. In fact, the Catholic hospitals and Catholic universities, would simply not pay for these services or pay for insurance that pays for them. Nothing stopping a woman who even calls herself a Catholic from going into a Planned Parenthood clinic or from going into a university health center and getting these contraceptive pills or sterilization or morning after pill and using them, right? I mean, so who's preventing the women from getting this quote, preventative treatment?
Stopping women from being able to access that treatment through their health care does in fact deny them the option and prevents them from exercising that option.
No, it doesn't prevent them.
Providing the insurance doesn't require anyone to use it.
But it doesn't prevent them from getting the services. Well, what prevents them from going into a community health care clinic and getting an Ortho Novum 777 prescription? Nothing, except they're going to have to pay out of pocket versus violating the conscience of the employer.
Yes, so if you can afford it, you can have access to full health care, and if you can't afford it, too bad for you. Health insurance ought to cover all basic health insurance needs. And,
so you were in favor of the original. You were in favor of the original edict from HHS, were you not? You were one of a number of clergy who signed on to this, saying that this was exactly what women needed for, quote, preventative care.
Absolutely. The original regulation already allowed an exemption for the over 300,000 churches and houses of worship in this country. They already could opt out. What it didn't allow are institutions such as hospitals and schools, which receive federal funding, to opt out. I'm not really in favor of having my tax dollars used to promote a religious principle that my church has disagreed with for decades, nearly a century as a matter of fact.
But You actually have given speeches in the past, and it's an issue that a lot of people think is involved here, and it will be down the road, on abortion. And you've said in the past that you believe abortion is a blessing and can be a blessing. You even referred to late-term abortion as a, quote, blessing in a speech in 2007. I read this paragraph of something, I guess you said in a speech, and I was quite stunned by that. And I guess my question to you is, if it should pay for sterilization and the morning after pill, why shouldn't insurance also be compelled to pay for abortion services free of charge? Should it?
That's an entirely different issue. What the president has managed here is a compromise that allows women access to contraception, which will reduce the need for abortion. And I think we all can agree that the fewer abortions needed, the better off we all are.
Right, but if abortion's a blessing, why do we need fewer abortions?
Well, the same reason heart transplants are a blessing, but we prefer not to have people need them. The late-term abortions take place to save women's lives. It would be wonderful if fewer women needed that.
But you still stand by your statement that abortions are blessings.
When you need them. So is cardiac surgery when you need it, though I prefer never to need it.
So a sick heart is the same as a beating heart in a child.
Yeah, we could spend a lot of time debating that. I think you're completely missing the mark.
No,
and,
we should,
and twisting
but I think
twisting the
you
concept.
would prefer,
we could do that, but that's not what's on the table today.
Right. But you would prefer that abortion's covered under this mandate as well. I mean, that's no secret, right?
I am delighted at what he has been able to accomplish, and I am perfectly happy to applaud that.
I appreciate it. Reverend, thanks so much for...
True or false? Your pet is